I brought in an expert to answer that question. My partner David, who's also a medical scientist.
Healthcare scientist.
Healthcare scientist, right. So the question about modern options in the no blood procedures, like what was available in the past and available now, what would you say about it?
Well, there is modern options. That is a fact. It's not as good as real blood. You just look at the survival rates for between trauma cases with blood and trauma cases without blood. There's a massive drop.
Yeah.
But you'll have a survival case of 70 to 80% with blood, or a survival case of 10 to 20% without. So.
Okay. But what are the modern options? Like, you know, when they talk about bloodless medicine, because witnesses are always, when I was a witness, there was a lot about all these bloodless options, and they were basically made out to be like, you know, the next best thing, and that the implication was that they were saying that the doctors and specialists are basically not wanting to advance. They wanted to stick to just using blood when there were better options.
No, we would how science doesn't work like that. You always go for the best option.
Yeah.
And you're always looking for the best thing you can possibly be, but at the minute there isn't anything out there that's as good as blood for replacing it. So we as scientists, we will always look for new techniques, new practices, new ways of doing things, new inventions, stuff. But until you make an artificial blood, and whether Jehovah's Witnesses accept that or not, then the survival rates are always going to be less.
So when I was a witness, there was a lot of talk about things like cell salvage, obviously saline and...
Amazing. Saline does not replace blood, it's just salty water. So you're missing all the hemoglobin. But cell salvage, fantastic. But whether you can get that set up in time on someone who's losing 3-4 litres, you know...
Does that clean the blood then? Is that what it's for?
Cell salvage is, from my understanding of it, it's used mainly in operations for high risk procedures, where they clean the blood and you put it straight back in. So you clamp off a vessel, reclamp it somewhere else, and it goes around the system and gets clean and put back in. You can't do that with someone who's bleeding out left, right, and centre from a car crash.
Okay, yeah. So that could be okay in planned procedures, but the issue, So the issue is with accidents, trauma, sudden bleeding, where you've got to stop it quickly and you've got to replace the lost blood.
If you're going to use for example, if you're going to use cell salvage on a brand new mother who's losing blood, you would have to have that equipment set up before she even went into labour or during labour for it to be effective. And even then, you're not dealing with the loss of blood, the site of the loss of blood. You'd be clamping off an artery somewhere and you're putting it through the cell saver, but if she's losing it where we wouldn't actually lose it from, you're not salvaging it and putting it back into the system, if you know what I mean.
Okay. So modern options good, but they're not the...
Better than what they were. So your survival rate would have been 0.
Yeah.
Now it's 10-15%, but with blood it's still,
higher than
75 to 90%. You just Google search it. It's like really obvious. Just look, do your research. Is that the saying? Do your research?
Yeah, do your research. But yes, thank you for the question. Hope that answered it. If not, post another question and then we'll take it from there. Yeah, thank you.